Hello, I'm Shamala Ramasamy. I am a psychology student, and for this course of Dynamics of Adjustment module, I'm going to present the topic on psychological changes in aging and coping strategies for older adults. First of all, we have to know what aging is. So, by 2030, 1 in 6 people globally will have aged around 60 years and over, according to WHO. And aging is a universal process. It's a lifelong process involving biological, psychological, and social changes. So aging is not merely about physical decline, and psychological aging encompasses how our minds, our emotions, our personality, and our social world changes as we grow older. So changes happen in cognitive ability, emotional functioning, personality traits, and also social relationships. Importantly, there is tremendous individual variability. Some adults maintain sharp cognitive functions in their late 80s or 90s, while other older adults experience decline of the cognitive functions earlier, maybe in 60s or 70s. So how cognitive changes happen in aging? So normal age-related changes are like slower processing, reduced working memory, decreased executive functioning, and uh, lesser attention. So cognitive aging involves both losses and gains, like processing speed slows down, working memory and executive functioning become less efficient. However, there are preserved abilities, cognitive abilities in some adults, older adults, crystallized intelligence and procedural memory, which is accumulated knowledge and wisdom, often continues to grow in some older adults. This explains why an older adult might take longer to learn a new smartphone application, but can offer profound life advices, based on decades of experiences they have. Yeah, so it is crucial to distinguish between normal age-related changes from pathological conditions like dementia and uh, mild cognitive impairment. The cognitive changes that is happening in the older adult affect daily living. So as I said just now, slower processing, reduced working memory, decreased executive functioning, and also slower divided attention. These are real changes which happens in the daily life. These cognitive changes have real consequences. An older adult who was once the family's financial manager may suddenly struggle to, let's say, balance the checkbook, let's say. So this is not laziness, but it's a genuine cognitive decline. So emotional toll also can be significant frustration. They feel embarrassed and they can withdraw from social activities as well. So some older adults stop driving, not because of physical limitations, but because maybe multitasking in traffic becomes cognitively overwhelming. So these are some of the examples: struggling to use online banking, missing a doctor's appointment, or missing um, the medication, needing help in terms of tax filing, bills payment, and tripping while walking, and while talking simultaneously, and so on. These are the examples of daily life. Older adults also go through emotional and personality changes while aging. Contrary to stereotypes, emotional life in older adulthood is often more stable and more positive. So the positive effect describes how older adults preferentially attend to and remember positive information or messages. They only focus on emotionally meaningful goals. For example, spending time with loved ones rather than networking at large. And however, loneliness and depressions remain serious risk, particularly for those who have lost their spouse or live in isolation. So all these changes happen within them as they age. So social emotional selectivity theory says that as people perceive time as limited, they prioritize emotionally meaningful relationships and keep close to the loved ones. Also, social relationship changes when during aging process. Social relationships undergo dramatic changes by the age of 75, for example. Many have lost their spouse and maybe close friends or close relatives and so on. Retirement removes uh, the daily colleagues networking. So that's why people hate retirement when they are very physically they are active. They hate retirement, but what to do because the country's policy is like that. Children have moved away, and the quality often replaces with quantity. Yeah, so older adults report their remaining relationships are more satisfying than ever. For example, grandparenthood provides new source of purpose in life, meaning in life. The danger is isolation, loneliness, because roughly 1/4 of the older adults are socially isolated, with consequences as severe as smoking for mortality risk. Yeah, so that is the danger of isolation. Now we come into coping strategies. Cognitive preservation is possible. The concept of cognitive reserve explains why some older adults maintain sharp minds despite brain changes, physical brain changes. Learning new skills and learning a language, for example, learning an instrument or music or whatever not, or even how to use a tablet, a phone or whatever. So builds the cognitive reserve. Physical activity is one of the most powerful interventions. Let's say brisk walking for 30 minutes per day reduces the cognitive decline risk significantly. And compensatory techniques are not, cheating, but they are smart adaptation. Uh, Using calendars or routines preserves the mental energy for what matters the most. Yeah, so we have uh, we have to reserve our cognitive ability from now on, and physical activity also we have to uh, just brisk walk, and we have some kind of a compensatory techniques we have to adopt. So what about emotional and social well-being? How we can cope? So emotional and social coping strategies are interconnected. Reminiscence therapy, meaning the process of reviewing and finding meaning in one's life has shown to reduce the depressive symptoms in older adults. And mindfulness interventions, for example, are highly acceptable to older adults and effectively reduce anxiety, research says. And socially, the key is proactive effort. So people, older adults need to go out, need to socialize with other people, maybe with the grandchildren and so on and so forth. And waiting for others to call leads to isolation. So they must make an attempt to call some people, to talk to, or just come to the house and have tea and so on. Senior centers, religious groups, and intergenerational programs also provide structured opportunity for social connection. Importantly, seeking therapy is not a sign of weakness, but it is a sign of strength, because they know that they are in isolation and so on. So they need to go for therapy. Late life depression is treatable, and older adults respond well to cognitive behavioral therapy tailored to their suitable needs. Sadly, we cannot evade losses in life. We cannot evade transitions in life. So, the selective optimization with compensation model offers a powerful framework for this problem. Rather than fighting decline, older adults can adapt by selecting fewer or more meaningful activities, optimizing their remaining abilities through practice, and compensating for losses with tools or with maybe alternative strategies. This is not giving up. This is not chickening out, or this is not surrendering. But this is winning, but in a different path, winning differently, they call it. So successful aging also requires redefining what success is for you. Success means maybe different for me and maybe different for you. So older adulthood may be less about doing something and more about being. More about being means valuing whatever simple things that I do. I value the presence of doing things. Yeah. So maybe a relationship, maybe uh, advice to other people, over productivity. So they are not bothered about the productivity. They are bothered about how qualitatively valuable their advice is to other people, and qualitatively they find meaning in whatever activities that they are doing. Accepting help is not dependence, but it is interdependence. Normal humans need help across the lifespan. We need scaffolding. We have read that before. As a conclusion, psychological aging is multidimensional. Cognitive, emotion, personality, and also social domains all change, but maybe not uniformly. One maybe changes dominantly in myself, and maybe for my other friend, it maybe emotionally she is affected, and so on. Losses coexist with gains, processing speed declines maybe, but emotional regulation and wisdom maybe often improves, because they have their life experiences to share with the younger generation. Environment matters, because supportive environment, physically, social connection, and purposeful activity buffers against the negative outcomes of their activities. Coping is possible and effective, yes, because coping needs for physical activity, for cognitive engagement, and also the social model, and professional support is needed, help is needed to improve all the qualities in life. And lastly, aging is not a disease. It's not at all a disease, because many changes are normative and manageable, and with appropriate strategies. These are my references, and thank you so much for listening.